Thank you all so much for being here. If you're not familiar with First Draft, we are a nonprofit based in London. We provide tools and resources to help people build resiliency against false harm and misleading information. We're really excited because this is the first session in a whole new series of courses that we have built all around understanding vaccine misinformation. Today, since this is our very first one in this time zone, at least, we're going to go over some what we believe are some essential concepts. So just to introduce myself, my name is Shaydanay Urbani. I'm based in our office in New York City, and I am our partnerships and programs manager. If you want to get in touch, there's my Twitter handle right there. We'll also give you some other information at the end of this presentation about our organization and how you can get in touch with us. So we are going to go over three things today. The first thing we're going to talk about is trust in vaccines. So we're going to look at some case studies from around the world to help us understand how different communities are responding to the vaccine and information about vaccines. Then we're going to talk about vaccine misinformation. So last November, our organization put out a big research piece where we looked at vaccine narratives that were prevalent online. So we're going to give you just a couple of the broad themes that we discovered when we did this research. And then the last thing we're going to talk about is tactics for sharing misinformation. So when we're thinking about the people who either purposefully or unwittingly share misinformation about vaccines, what are the tactics that are successful and effective for doing that? So jumping right in, let's talk about some case studies from around the world when it comes to trust in vaccines. I want to begin with Pakistan. So Pakistan is one of the few countries around the world where polio is still endemic. I believe there are only two countries in the world where that's the case, and Pakistan is one of them. And there has been an international effort on the part of NGOs and on the part of the Pakistani government to vaccinate the country for polio, and especially vaccinate children. And this was going fairly well, but then something happened. In 2019, in April specifically of 2019, a series of misleading videos claiming that kids were falling ill from the polio vaccine began to go viral online. And this had a huge effect, especially in one region. I want you to pay attention to the region. But this northern region here in Pakistan, in a city called Peshawar. And unfortunately, because of these videos, efforts to vaccinate the Pakistani population in this area came to sort of a standstill. So I'm going to read you this quote. This is a quote from a CNN report from a deputy police commissioner that they had spoken to at the time. And the quote says, "People rushed to the loudspeakers of nearby mosques, barring people to stop polio drops to their children. They also suggested people to take their children to the hospital immediately as some poisonous material had been added to the vaccine." So I read you this quote because it sort of shows like a domino effect of what happened. So we had these misleading videos that emerged, but then local leadership started speaking out as well. And unfortunately, what happened was that 25,000 children in Pakistan in a short period of time were rushed to hospitals, completely overwhelming the hospitals there. This is an interesting chart that shows you the number of cases of polio in Pakistan. And if you look at it, if you look at these first 4 years, starting in 2015, you can see that cases started to be contained, right? And then April 2019 hits, and the number of cases of polio just skyrocketed. So it's pretty clear that this breakdown in trust in these videos had a very profound effect on the country and the state of polio there. This is a sort of a similar chart. So if you look at this chart, this is looking at Google searches for polio-related keywords in Pakistan. Um, so if we're looking at April specifically, this is the date when the videos went viral, and you can see that search interest for the videos also skyrocketed around the same time. Now, it would be easy to look at this and say that the breakdown in trust of the polio vaccine was solely because of this series of misleading videos. I mean, we see these charts, there is a very clear reaction, right, when it comes to what happened once these videos were shared. But I want to talk about this because I think that that's not the whole story, right? So in 2011, several years before these misleading videos were shared, allegations surfaced that the American CIA orchestrated a failed vaccination campaign to obtain Osama bin Laden's family's DNA. And this was, I believe it was a hepatitis B vaccination campaign. It sounds a little bit outlandish, but unfortunately, it surfaced that these allegations were true and that the US CIA had done this and they had taken advantage of healthcare workers in order to get this information. And if you want to read more about it, there are some articles you can look at. This one that we list here, this is from Scientific American, but I know other places have written about it as well. And I bring it up, um, one, to sort of explain this concept that we teach a lot at first draft trainings, which is that misinformation often has a kernel of truth. And this goes just the same for even more ridiculous sounding conspiracy theories. I think that sometimes, especially, sort of in the misinformation space, disinformation space, as journalists, as people who are public relations people trying to get good information out there, sometimes there is a tendency to look at conspiracy theories and to dismiss them, right? But most misinformation does have a kernel of truth. And in this case, in the case of Pakistan, where there was all of a sudden extreme distrust in the polio vaccine, there was actually a history of people feeling lied to that was true, right? And the other thing I want to point out about this case study is that if you look at the region where this happened years ago, it's the same region where the misleading videos went viral, right? So what can we learn from this case study? Well, first of all, we know that misleading videos had a profound effect on the breakdown of trust. And likely they sparked the breakdown of trust in the polio vaccine. But the other takeaway is that there was a real history of Western influence exploiting health workers in the same region that likely contributed to these feelings of mistrust in the same region. So we're going to come back to that. But next, I want to talk about the Philippines and the Dengvaxia controversy, because there are a few different things that we can learn from this case study. So Dengvaxia is the vaccine that is meant to fight dengue fever. And if you're not familiar with that, dengue fever is a mosquito-borne viral infection. It's endemic in more than 100 countries, and the Philippines is one of those countries where it began to become a problem. So let's look a little bit at the timeline of what happened in the Philippines, because this case study is a little more complicated. I think there are a lot of different factors that contributed to the breakdown of trust here. So we're looking at December 2015 is when Dengvaxia was registered in the Philippines to help fight the rise of dengue fever there. Around March 2016, some health experts began to vocalize hesitation about the vaccine. There were some discrepancies in the reception of it. But even so, the government pushed through with the program. There was a school-based vaccination program, and they started to vaccinate quite a lot of people. There were 830,000 kids vaccinated for this vaccine. And then something happened, right? In November of 2016, the pharmaceutical producer of Dengvaxia, a company called Sanofi, announced that the vaccine may be dangerous in rare cases of children who haven't yet had the infection yet. And the warning was that if children haven't had the infection yet and they receive the vaccine, then when they do get the infection, they'll get it worse. So some countries that were instituting Dengvaxia responded to this by implementing stricter guidelines, by having stricter labeling requirements, but not the Philippines. In the Philippines, there was sort of a policy 180. They completely halted the vaccination program, and this set off a little bit of a moral panic. People began to be very scared. A couple months later, a Senate investigation into the controversy started. And this was a protracted Senate investigation. It went on for quite a while. Around the same time, there were also claims online that were surfacing, pictures and videos that were claiming that children were actually dying from the vaccine. These claims turned out to be totally unfounded, but they went quite viral. And unfortunately, the media in the Philippines did quite a lot to amplify both this protracted Senate investigation, which unfortunately focused a little bit more on the politics and the corruption side of the charges, and not so much on the safety of the vaccine. But they also amplified these viral claims about children dying. And the results of this controversy were dramatic. So this is research done by the London School of Hygiene and Tropical Medicine, showing the percent of respondents who agree that vaccines are important. And you can see that in 2015, 93%, so quite a high number, 93% of respondents agreed that vaccines are important. And then in 2018, after the Dengvaxia controversy, this number completely plummeted by 60%, and only 32% of people agreed that vaccines are important. So quite a significant drop. So what can we learn from this case study? So a couple things. As with Pakistan, misleading claims that went viral on the internet were part of the breakdown in trust, but they weren't the whole story, right? We had the fact that, looking at public policy, the Philippines suspended the vaccination program entirely instead of doing what some other countries did, issuing guidelines, labeling. You know, it was a very dramatic reversal in the policy. And then we also had this protracted Senate investigation, which focused more on the politics than on the vaccine safety. Let's look at a couple other examples as well, and then we're going to tie this all together. So looking at the United States, here in the US, we have two demographics that are most likely, according to research, to be vaccine hesitant. And this research that I'm citing, in case you want to check it out, is from the Kaiser Family Foundation, their COVID-19 vaccine monitor. So in the US, Republicans and Black Americans, Black adults, are most likely to be vaccine hesitant. But what's interesting about this data is that the reasons are very different. So if we're looking at Republicans in the United States, we can see that the main reason they say they would definitely not or probably not get vaccinated is that they think that the risks of COVID are being exaggerated. Now, if we look at Black Americans in the US and we look at this reason, it's not at all the case that Black Americans are as likely to think the risks of COVID are being exaggerated. That's not the reason, or at least it's not the main reason they're vaccine hesitant. But there are other reasons. So you can see these numbers are quite high. So 71% of people said that they're worried about possible side effects. And also 71% say that the vaccine is too new and want to wait to see how it works for other people. And it's hard to say exactly why this is. We'll talk about this in later presentations as well, but the US also has somewhat of a fraught history of using people of color in vaccine testing and trials. And so, sort of like Pakistan, and thinking about what happened there are historical reasons to mistrust vaccines, right? Let's look at Hispanic adults in the US. So this chart, I think, is interesting for two reasons. One is it shows that younger Hispanic adults are on average much less trusting of information about the COVID-19 vaccines than older Hispanic adults. But even more interesting, I think, is this gradient we see here. So we see at the top, it lists their own doctor as a source of information about the vaccine. And then we get to more and more political sources of information. So we have the Center for Disease Control and Prevention in the United States. We have the FDA, the Food and Drug Administration, Dr. Anthony Fauci, President-elect Joe Biden, state and government officials. And you can see that the trust drops and drops and drops as you get more political, right? So people have quite high levels of trust when it comes to their personal doctor, but that trust drops off dramatically when you're talking about sources that are more politicized. And this shouldn't be a surprise when we're thinking about the other case studies as well, right? In both Pakistan and the Philippines, you had this element of politicization of vaccine information that caused mistrust, right? So I want to read you this quote, and this is from Dr. Heidi Larson, who is the director of the Vaccine Confidence Project. If you're not familiar with the Vaccine Confidence Project, I highly recommend you check out their website and you check out their research. They have a ton of resources and a lot of really interesting research measuring vaccine confidence around the world. And looking at different communities and different infections and the vaccines for them. And so this is in a report from the New York Times, but Heidi Larson says, I saw how much of the communication strategies were very much driven by what the public health community and immunization people thought the public needed to know, but they weren't responding to what people's concerns were or issues or questions. So I talk about this quote and as sort of a wrap up for these case studies to say that what is clear when you dig in to why communities around the world have mistrusted the vaccine, we can see that there are very different reasons for them, one, and also that there are very legitimate reasons for them. So when we're thinking about how to be better communicators and about how to get out good quality information about vaccines, we have to approach it from a stance of understanding, right? And trying to connect with people and understand what their concerns were. Because otherwise, we're not going to be, our messaging isn't going to connect with people as much, right? So moving on, let's talk about some themes from the research that we did on vaccine misinformation. So this is a little bit of this is a new section, but I want to talk about a couple of these things we found with you guys. So you can find this research on our website, firstdraftnews.org, and looking at the research section, but we're also going to talk about it more in our next session, next Thursday. But what we basically did was we analyzed 1,200 posts across different languages, French, English, and Spanish, and across the web for content that was talking about vaccines. And we tried to understand what the narratives were that were sort of framing the conversation around vaccines. And one of the interesting things that we found is that two themes were dominant across all of the languages. One was a lot of the conversation around vaccines was about political and economic motives surrounding the vaccines. And then the other big topic was safety, efficacy, and necessity. What's interesting, though, is that the narratives that were dominant were different across different languages. So these are, again, we're going to talk about this more in the next session, but these were the different narratives that we surfaced, and you can see that liberty and freedom as a narrative was quite popular in English speaking posts, but we didn't find it at all in Spanish speaking posts. On the other hand, morality and religion was a huge framework that people were using to talk about the vaccine in Spanish speaking posts. And then the other thing that we found is that engagement by platform for each language differed as well. But one thing that we were not so surprised by, but was interesting to note, was that vaccine misinformation is actually very prevalent on Instagram. And one of the interesting things about that is visual based platforms like TikTok, like Instagram, are harder to research than text-based platforms like Facebook and Twitter. And so we tend to have quite a lot of research about text-based platforms, but we don't have as much about visual platforms. And that is clearly an issue because, as you can see from these charts, vaccine information is proliferating on visual media. And you can see that in this chart as well. So Facebook pages tend to drive the vaccine discourse on social media, but Instagram is quite a big player as well. So this is our last little section for this webinar, and it's all about the tactics that we have found that people use when spreading misinformation. So we have a lot of training that we do on this topic, but I'm going to give you just a couple of things that we saw that were particularly prevalent in our vaccine focused research. So one is this idea of headline laundering. So what does that mean? Headline laundering is what we call when people take a news report that has sort of either negative or ambiguous slant to it. Maybe something about the headline is ambiguous, for example, and you don't really get the full picture until you read the article. So people take those news reports and then sort of repurpose it to push their agenda. So this is a screenshot my colleague took of a Facebook group titled Open Oregon. It's like an anti-lockdown Facebook group. And you can see that this person has posted this article and said, "No need to quarantine if you've had both doses of the vaccine. See where this is headed?" ? And it's hard to know exactly what that means, but when you look through the comments, and this was a very popular post, when you look through the comments, you can see that a lot of people are suggesting that they're using the idea that you don't need, that the government is using the idea that you won't need to quarantine if you've had the vaccine in order to force people to take it, right? So that's what we call headline laundering. We've seen a huge proliferation of conspiracy theories. So posts about Bill Gates and how he's trying to control the world, posts about microchips and the vaccine is trying to get a microchip in your body so that the government can control you. And again, a lot of these might sound a lot of crazy, but what's important to understand about them is that they feed off of mistrust of political actors and institutions. And as we saw in our research and also in the case studies, a lot of vaccine misinformation feeds off of mistrust of politicians and confused messaging from policy and politicians as well, right? This is an important one. So one thing that we found, and this is true not just of vaccine misinformation, but it's true of misinformation in general, is that it's overwhelmingly driven by videos and photos. And one of the One of the problems with this is that visual content is very difficult to fact check. Photos and videos are emotive, they're compelling, they play off of people's fears and emotions. Often, what we've had in the past to counter misinformation are things like articles and fact checks, and those just don't tend to compete as well with this content that is very like it grips at your emotions, right? And then one of the last themes that we found is what we're calling zombie content. So when it comes to vaccines, there's a lot of old misinformation tropes that tend to live on and live on. So I'm sure you've all heard by now of the purported link between the MMR vaccine and autism. It continues to be a very prevalent narrative, and we see it recycled over and over, and that, that may be because it's compelling, but it also may be because of amplification by the media, and maybe also because we don't have the right kind of messaging to address the concerns and the trust issues that are sort of embedded in those old tropes. So we're wrapping up. I hope that you learned something from this presentation. Next time, we're going to dive into misinformation narratives and data deficits. So we're going to look a little bit closer at our research. We're going to look a little bit closer at some of these misinformation narratives, but we're also going to talk about what we call data deficits, which is topics that lack quality, reliable coverage, and topics where, because of that gap in coverage, misinformation comes and fills in the gap. So, we're going to talk about some ways to sort of identify data deficits and identify topics where there's a real need for quality information and how to fill that.